These are the 10 scariest diseases in the world. They're terrifyingly real. Number 10. Noma. Also known as cancrum oris, noma infects the mouth or genital areas. Those afflicted develop ulcers inside their mouths, causing the tissues to wear down until the bones of the mouth are showing. These days, it's found in only the poorest parts of the world, although it was once far more common even in developed European countries and in the United States. It was widespread among inmates in concentration camps during World War II due to the horrendous living conditions. Noma is generally a result of poor hygiene, drinking contaminated water, a lack of nutrition, or immunodeficiency diseases. While it's disappeared from industrialized areas, the mortality rate is at about 90%, while those who survive must live with its effects forever. Number 9. Emesedema. Commonly referred to as Madura foot, emesedema is capable of spreading all throughout the body, but typically confines itself to the legs and feet. Initially, one suffering from this disease will notice a swelling on their foot, followed by a discharge of pus. The fungus then spreads over the area and can eventually cause serious damage to the surrounding tissue, eventually inhibiting the use of one's foot or leg. Madura foot is actually fairly painless, which often leads to a late diagnosis. Researchers have discovered ancient writings referring to this disease in India, where it was referred to as padavalmika. There are currently no vaccines to treat Madura foot, but it can be avoided by keeping your hands and feet clean, as well as wearing shoes while in fields and other natural areas. Number 8. Complex Regional Pain Syndrome. Complex Regional Pain Syndrome, or CRPS, refers to a disease involving the breakdown of the nervous system and central nervous system. It causes severe pain, changes in the skin, and swelling. Studies also show that the pain and discomfort caused by CRPS can lead to mental health issues such as depression and anxiety. Symptoms begin to show after serious injury involving tissue damage. Though it usually begins on the arms or hands, it has the potential of spreading all over the body. Someone suffering from CRPS will feel burning and stabbing pains or grinding and throbbing sensations. This disease is treatable, although the road to recovery is a long and complicated one involving physical therapy, medicine, and sometimes surgical procedure. Number 7. Leprosy. Leprosy is a type of infection that causes inflammation in the skin, eyes, nerves, and respiratory tracts. It's contracted from exposure to a certain kind of bacteria called Mycobacterium leprae. Symptoms can actually go unnoticed for years, but can result in poor eyesight and a loss of feeling in the infected area. The latter also leads to a loss of body parts, as wounds and infections will go untreated. Leprosy has been around for thousands of years. In the old days, they used to quarantine anyone with leprosy into leper colonies so the disease would not spread. But modern science has proven that it's actually not all that contagious, so taking such measures did little to stop it. Leprosy is often referenced in the Bible, although scholars believe any biblical reference to the world likely refers to not just leprosy as we know it today, but also a wide array of diseases involving scaly skin. Over the centuries, there have been many methods of treating leprosy, including blood sacrifices of children or virgins, and rituals involving snakes. Today, multi-drug treatment is available to rid victims of their sickness. Number 6. Filarial worm. The filarial worm, or Loa Loa worm, is a parasite that has the ability to live in people's eyes, causing a condition called filariasis. It affects over 200 million people and is the second leading cause of blindness. Filarial worms are not contained just in the eyeballs. When they occur elsewhere in the body, they cause a condition called elephantiasis, which results in the lower extremities swelling up larger than normal. Other potential symptoms include rash, intense abdominal pain, arthritis, and urticarial papules. Curing filarial worm infections depends on exactly what subtype of filariasis one has, but is oftentimes treated with antibiotics such as doxycycline and albendazole. Number 5. Vibrio vulnificus. Vibrio vulnificus is contracted through eating raw shellfish. It can also affect those swimming with an open wound, as well as stings from stingrays and tilapia. This disease comes with many symptoms, including vomiting, intense diarrhea, blistering dermatitis, and severe abdominal pain. To make matters worse, Vibrio vulnificus weakens the immune system, affecting both your liver and bloodstream, and ultimately killing those who do not seek proper treatment. The origins of Vibrio vulnificus only date back to 1979. Scientists believe this is because of the general increase in temperature and a decrease in salinity levels on the coast, leading to an increase in the pathogen. While it's most commonly contracted from eating contaminated raw oysters, 2005 saw a massive increase in Vibrio vulnificus cases among the Hurricane Katrina victims in New Orleans who were surrounded by contaminated floodwaters. Number 4. Pica. Pica is a disorder that causes people to inexplicably gain an appetite for non-food items. This can range from anything from paper and wood to feces or urine. It does not include people with mental disabilities or anyone who eats non-nutritious items for cultural or religious reasons, making it difficult to diagnose since it can potentially be caused by symptoms of another unrelated disorder. Problems from pica can be quite severe. Infection from feces and dirt pose serious health hazards. Additionally, someone suffering from pica might ingest an item with toxic chemicals such as paint or lead, which can ultimately lead to poisoning. In St. Joseph, Missouri, one patient in particular was found with more than 1,400 items in his stomach. Historically, pica dates back to the 13th century when it was referenced in Greek and Roman literature. By the 16th century, instances of this disorder began appearing in medical texts, but it is still unknown how many of those instances were actually behavior resulting from pica or were signs of another disease altogether. The name pica comes from the Latin name for the magpie bird, who's known to be unusual and indiscriminate about what it eats. Number 3. Fibrodysplasia ossificans progressiva. With fewer than 800 cases worldwide, Fibrodysplasia ossificans progressiva, or FOP, is a very rare disease and nearly impossible to treat. FOP causes the body's tissue repair system to quit working and begins to heal damaged muscles, tendons, and tissues by turning them into bone. The new bones, however, do not have flexible joints like everyone is used to, so once they start to grow throughout the body, it makes it nearly impossible for someone with FOP to move. Cutting off the newly formed bones makes the problem even worse. Once that happens, the bone growth runs even more amok and causes more bone to begin growing, thus causing a faster deterioration of the body. In the most extreme instance, a man named Harry Eastlack managed to live up to 40 years old with FOP, and by the end, was completely immobile aside from his lips. Mr. Eastlack donated his body to science soon before his death, and his skeleton remains at the famous Mutter Museum in Philadelphia, Pennsylvania. Number 2. Clarkson's disease. Clarkson's disease, or its more scientific name of systemic capillary leak syndrome, or SCLS, is a condition in which one's blood vessels begin leaking plasma. But rather than bleeding externally, the plasma is absorbed by the skin with nowhere to go. They then begin bloating like a balloon. Although rare, the only way to treat Clarkson's disease is to inject fluids into the body to counter the bloating, then wait it out. This is a problem unto itself since it takes 3 full days for the bloating to stop. In addition, it can lead to damage to vital organs and tissues, ultimately causing death. SCLS gets its name from Dr. Bayard Clarkson, who first diagnosed the disease in 1960 in a patient who was experiencing spontaneous bloating. Since then, about 150 people have been diagnosed with Clarkson's disease, though little research has been done. The cause of it is still unknown. Number 1. Elephant Man Syndrome. Joseph Merrick was born in Leicester, England in 1862. Joseph was born as a healthy baby, but as he grew older, he began to show signs of a bizarre physical disorder. By the time he was 5, he was developing thick, lumpy skin with a similar color and texture to that of an elephant, hence the nickname Elephant Man. His right arm and hand grew to a disproportionate size from that of his left, and both his feet swelled up to enormous sizes. The skin on his face also appeared to be lumpy. To this day, medical experts are baffled by the cause of Merrick's condition. Although there is no consensus, there have been a few theories submitted. Merrick himself believed, as did many people of his time, that his condition was a result of maternal impression. This theory states that a deep emotional trauma or feeling experienced by a pregnant mother will have an effect on her unborn child's development. Apparently, Merrick's mother had been frightened and knocked down by elephants at the fair, and as a result, she gave birth to what became known as the Elephant Man. Others believe he may have had Proteus syndrome. This is a condition in which king overgrowth and abnormal bone development cause tumors to grow all over one's body. Most experts think it was a combination of Proteus syndrome and other conditions such as macrocephaly, hyperptosis, and neurofibromatosis. Despite all these theories, the exact cause of Joseph Merrick's deformities remains shrouded in mystery. Find out more about other deadly diseases by subscribing or clicking on one of the links below.